At Risk International Foundation, WARIF for short, is one of Nigeria's foremost organizations tackling sexual violence. In addition to drawing the world's attention to rape and gender-based violence, WARIF takes a holistic and survivor-centered approach to helping affected girls and women, as well as launching preventative initiatives to tackle the root causes of rape and other forms of sexual violence. We're now being joined by founder of WARIF, Dr. Dasilva-Ibru, to discuss her goal of bringing about a world in which all women and girls can live their lives free from gender-based violence. Good afternoon. Thank you so much for being here.
Thank you so much for having me.
Good to see you again.
Lovely to see you again.
Well, this is my first time meeting you. It's a pleasure to meet you. I know you threw that in my face.
Oh my gosh.
Yeah,
but great to have you.
Times.
Can you tell us the backstory of what inspired this cause for you?
So my backstory is actually my day job. I'm a healthcare physician. Specialty is obstetrics and gynecology. So my patient population are women and girls. So when I first moved back to Nigeria, I started working in the public sector, and I started to see many disenfranchised girls and women, started treating horrific cases of violence, and I recognized that there was a gap to fill. WARIF is an acronym for the Women at Risk International Foundation, and it was established in response to this prevalence of rape and sexual violence of girls and women in many communities across our country. I mean, the statistics that we're working with now is 1 in 4 girls before the age of 18 would experience at least one violent sexual encounter.
All right, then, from what I know about WARIF, you do take a holistic and survivor-centered approach in addressing sexual violence. So I wanted you to elaborate a bit on how this approach works in practice and why it is critical to the healing process for survivors.
So when you look at a problem such as gender-based violence, this is a global problem. I mean, we talk about 1 in 4 girls, globally it's 1 in 3 women. It's a problem that's so layered because you see all the intersections at play. You're dealing with a problem that affects everyone in a low middle-income country like Nigeria, where you have a patriarchy that subjugates women already and girls. We have social norms, cultural practices that are amazing, but we also have cultural practices that encourage the violence. We have a lot of intersection with other issues. We have poverty, we have education or the lack thereof when you see families that have to make a decision between the boy and the girl in the home. And then you have a woman or a girl in this environment being raped, enduring acts of violence daily, forced to remain silent because there's that culture and that stigma that's associated with it, in a community that would shame and blame her and would align with the rapist because it has to be her fault. She must have done something wrong. And all of this occurs without her having a voice, without her having agency over herself, over decisions in her home, without any representation when she looks out, politically, economically, or otherwise. And so where does she go? What does she do? And this is where we step in the gap. The holistic approach focuses on not just the health. The woman that endures a horrific encounter has to be treated.
Yeah.
If we're looking at it through the judiciary and access to justice, she needs a forensic medical examination done in a timely fashion to assist her to seek justice. She needs to have testing done. She needs drugs. She needs counseling because emotional abuse is just as upsetting and devastating as the physical violence. And then she needs assistance with welfare. Financially, she may not have the wherewithal to leave the home of abuse. She might not be able to access a lawyer. So we have to assist her with shelter. We have to assist her with legal aid. So the health aspect has to be looked at through that lens. But beyond the holistic lens of assisting her under the health pillar, we have to look at how do we prevent this issue. Let's take a step back. Let's look at the advocacy. What's happening in the educational space? So we prevent by implementing programs. We go into schools. We talk to adolescent girls. We talk to adolescent boys. We implemented the first ever online classrooms in universities. We had over 106 universities participate. And then we go into rural communities. 54% of Nigeria is rural. These women don't have access to my social media platforms. We have an 0800 number. It's amazing. It's free. Women can call 24 hours. But the woman in that rural community hasn't got a phone. But she's still dealing with a 1 in 4. So we take our programs to her and we work with the stakeholders in those communities, and then we build them so that they start to see the ripple effect of the access to care that they get through organizations like ours.
I'm blown away by what you've told us so far, and more power to you. Now, when you started narrating the backstory of this, you said when you moved back to Nigeria. Can I ask where you...
So my postgraduate was in the US.
Okay.
So I'm an OBGYN specialist, and then I'm also a public health physician.
Okay, the premise for that is when you compare to Nigeria's legal framework around sexual violence, it remains notoriously weak, as we must have definitely observed. So how do you strategically navigate the intersection between grassroots intervention and systemic legal reform?
So the first thing we need to establish is we do have laws. And our laws have, I wouldn't say recently, but up until 2015, were amended. We're all very much familiar now with the VAP Act. We've been talking about this act that was amended, and it was meant to represent a lot of the gaps that were in the laws that were archaic. It spoke to rape as it pertains to not just women, but men. It also spoke about the punitive measures that should be implemented. Our issue is the cohesion. We have a law that we've been trying to domesticate since 2015, and we've only very recently, in 2024, had it domesticated in all 34 states. But is it being enforced? That's the question. And that's why when we look at the legal framework, we have a huge gap between enforcing the laws and actual conviction rates. So this is where the disconnect lies. And this is where more attention needs to be placed, so we can see more of these cases being prosecuted, and we can see the conviction rates go up.
Okay, so you said two things when you were answering the question earlier. It's really talking about community and how it's, how it's important in, like, when we think about the grand scheme of things and how it factors into, domestic violence. So when we talk about community and engagement, often cited as vital in addressing sexual violence, how has WARIF worked to involve local communities in your initiatives? What challenges do you face in changing long-held cultural norms? And on the flip end, when we look at the nature of gender-based violence in Nigeria, if we look at it, it has changed over time with factors like increased digital connectivity, economic instability, and urbanization. So on the flip end of that, how is WARIF adapting to these changes, and how are you working with these communities to fight this long-held cultural norms?
Right, it's a great question. 54% of Nigeria are in rural communities. So if you're going to impact on a problem like this, you have to look at it not just through the urban centers, but through these rural areas. So we work with stakeholders in the communities. Anyone that has spent time in any rural community recognizes the first thing is the trust factor. Forget the number of degrees you have. If you're going into a space, you have to be respectful of the space, beyond just the people and the language, the nuances, their cultural practices. And then you have to engage them to get a better understanding of what the problem is through their lens. So the first thing we did was we recognized our gatekeepers in these rural communities. The traditional birth attendant, for instance. She's an informally trained healthcare provider. She has no medical training, such as I. However, she stands in the gap when it comes to provision of any healthcare for an expectant mother or a girl or woman. So she's the natural custodian of their secrets. However, she's never been trained on what to do when she has these cases placed in front of her. So we provide training. We started in 2017 with 500 of these midwives, the traditional birth attendants. Fast forward to 2024, we're up to 12,000 and counting across communities in the country. And we're seeing the ripple effect through strict monitoring and evaluation protocols. In the first year, we had 200 new cases referred to the WARIF Rape Crisis Center, because part of the training is to create a clinical pathway where the women not only are taught with a simple toolkit on recognizing these cases, but they're also taught a referral process. So they know who to send these cases to, they know who to call, who to contact. And then these women are then seen in specialized centers where care can actually be given. Wow. Beyond that, we recognize the traditional and religious leaders in these communities. These are individuals that come with their own sphere of influence, but they also come with community baggage, if you will. And so we create spaces, workshops, where we speak to all religious leaders as well as traditional leaders. And we try to encourage inter-community dialogue, where women have a space where they can lay down their concerns, and where leaders start to see the problem not just through that age-old lens of rigid, stereotypic male roles, but now recognizing that there are women that come and they have more to offer beyond serving them a tray of food. And we're seeing that ripple effect. And we're seeing more and more when we go back into these communities that these women are being given a little more respect. They're being deferred to in conversations. And we're seeing the impact in the community as a whole because girls are now speaking out against these issues.
Fantastic. In terms of the progress you've made in quality and quantity, I think you mentioned you went from 500 to 12,000 midwives. I almost had to take a step back.
And the beautiful thing about that is now these traditional birth attendants incorporate our training into their apprenticeships. So you can see that training of a trainer approach, and you can see how that multiplier effect is taking hold.
It's obvious your passion is glaring, but I'd like to ask you, have you hit your goals for 2024, those that you set? So what's left?
So here's the thing. If you look at the gender gap, I mean, a lot of the issues we speak about fundamentally is as a result of gender disparities. And when we look at the gender gap, we say that a country like ours, we're 125 out of 146 on that gender gap index. So already you can see that there's work to be done. When you look at sub-Saharan Africa, we're told that it will take 130 years for us to reach gender parity. Except we start thinking out of the box. So not in my lifetime. So we have to come up with innovative ways. We have to look at it through a multi-sectoral approach. It's not one person's problem or one sector's problem. It's both the governmental and non-governmental agencies. It's both the private and public sector. It's both that man and that woman. If we start to look at it through that collective lens, then we can start to see that shift in the needle. Then we can start to see the transformational change, and then I can hit my goals.
I can't wait for you to do those. But as we start to wrap up, I'd like for you to, of course, share some information with us about the walk on Saturday, how you can be reached, and if possible, in a minute or so, maybe share one of the success stories, like putting, not necessarily sharing the information, but putting a face to like a story. We've kind of spoken about it in very vague terms. For someone who might be looking at this now, I'm wondering if they could reach out. Just share a success story as we start to wrap up.
So first I need to speak about the march. So the WARIF No Tolerance March is an annual campaign. It's a global march across cities in the world. Last year we were in 10 cities across 3 continents. And the idea is we're raising an army of men, women, children to come out, to stand with WARIF, to say no tolerance to the issues of gender-based violence. This year it's on Saturday, December 7th. In Lagos, it's at 7 a.m. In the cities, Lagos, Nigeria, in the cities of Nigeria, in Nigeria, we have Lagos, Ibadan, and Abuja cities. Then in Africa, we have Nigeria and Johannesburg. Then if we go across to Europe, we have Frankfurt, London, Manchester, and then North America, we have New York, Washington, D.C., Houston, and a few others. So the idea is find your city, find the time, come out, walk or march with WARIF, and just say no tolerance to gender-based violence. So I know that you might be at the bridge. I know I've insisted that Cynthia join us at the bridge on Saturday. So I know at least I'm looking out for both of you at the bridge at 7 a.m. on Saturday.
Shaitan from Dr. Dasilva-Ibru. Find your city and find the time. I know you do, you're a superwoman.
Find the time.
But for now, you are a superhero. We'd like to thank you for the wonderful job that you're doing, wonderful work you're doing. And we'll do our best to join you. Dr. Kemi Dasilva-Ibru, founder of Women at Risk International Foundation, also known as WARIF. Thank you so much.
Thank you so much for having me. Really appreciate it.
Thank you.